Welcome back to our Riverside Chats. We've told you what recovery is and that it's different for everyone. Now we're going to tell you about the worst possible scenario if you use drugs. An overdose happens when someone takes too much of a substance. This can be very dangerous and sometimes even deadly. Let's look at why overdoses happen and how we can prevent them. An overdose occurs when someone takes more of a substance, such as medications, drugs, or alcohol, than the body can handle. This can overwhelm the body's system and lead to serious health issues, ranging from symptoms like nausea or dizziness to life-threatening conditions like seizures, respiratory failure, or even death. The severity of an overdose depends on factors such as the type of substance, the amount taken, and the individual's health condition. If you suspect someone is experiencing an overdose, it's crucial to seek medical help immediately. Overdoses can happen for various reasons, and they often involve a combination of factors. Misuse or abuse, taking more of a substance than prescribed, or using it in a way not intended can lead to an overdose. Accidental. Sometimes people accidentally take too much of a medication or drug, especially if they're not aware of the dosage or if they mistakenly take multiple doses. Drug interactions. Certain substances can interact with each other in harmful ways, increasing the risk of an overdose. For instance, combining alcohol with prescription medications can be very dangerous. Tolerance changes. Changes in tolerance due to illness, withdrawal, or a period of abstinence can make someone more susceptible to overdose if they return to their previous dose. Lack of knowledge. People may not be aware of the potency or effects of the substance, leading to unintentional overdose. This is common with illicit drugs and/or when using drugs purchased illegally. Underlying health conditions. Pre-existing health conditions or impaired liver or kidney function can affect how your body processes substances, increasing the risk of overdose. Can overdoses be prevented? That's a tough question to answer, but the short and long of it is this. There is no magic way you can use or misuse substances without the risk. The only way to prevent an overdose is to 1. Learn about the risks. Schools and communities can teach people about the dangers of drugs and alcohol. Doctors and pharmacists. Healthcare providers can talk to their patients about how to use medicine safely. 2. Use those medicines safely. Follow the instructions. Always take medicine exactly as your doctor tells you. Don't share medicines. Never take medicine that is not prescribed for you, and don't share your medicines with others. 3. Get help for addiction. There are treatment programs, special programs to help people who are addicted to drugs or alcohol. Support groups. People can join groups where they talk to others who are trying to stop using drugs or alcohol. They have a support system. 4. Reduce harm. Never use alone. 1-877-696-1996. It's a toll-free telephone number that can be called so people who use drugs don't have to use alone. No stigma, no judgment, just love. Naloxone or Narcan, a medicine that can quickly reverse an overdose of opiates. Making it widely available can save lives. 5. Monitor medicines. Tracking prescriptions using systems that track prescriptions can help prevent people from getting too much medicine. Pharmacists can help by making sure people understand how to take their medicines safely. Overdoses can be very dangerous, but by understanding the reasons why they can happen and taking steps to prevent them, we can help keep people safe. Education, safe medicine practices, addiction treatment, harm reduction strategies, mental health support, and proper monitoring are all important ways to prevent overdoses and save lives. We want to give a big shout out to the sources who made today's video possible. The information provided comes from a combination of reputable sources that discuss the causes and prevention of overdoses. These include the Center for Disease Control and Prevention, who provide extensive resources and research on drug overdoses, including statistics, prevention strategies, and educational materials. The Institute on Drug Abuse offers comprehensive information on drug abuse and addiction, including detailed explanations of how different substances affect the body and how overdoses occur. The Substance Abuse and Mental Health Service Administration. They provide resources on substance abuse prevention, treatment programs, and mental health services. The World Health Organization offers global perspectives on substance use disorders and strategies for preventing overdoses. Thanks for joining us today. We hope that you learned something new, and as always, stay happy and healthy. Until next time.